I'm Dr Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery, and welcome to this video on Big Pharma Wants Your Thyroid. Well, what's it all about? Many people have thyroid problems, and the one I'm going to talk to you about is Graves disease. And Graves disease has become a market for Big Pharma to give you very specialized drugs to stop the inflammation and bring it under control. Now, some of these drugs are very, very useful, and they've got all sorts of applications in cancers and inflammatory control, and they're being pushed onto everyone. With Graves' disease, it's a little bit different. Yes, it's an immune disease. It's not a thyroid disease, so it's an immune disease, and it features inflammation as the driving force behind all the problems that you get. So, very specialized anti-inflammatories targeted. And what I want to talk to you about is the marketing of these drugs onto doctors and patients. And it's all dressed up very, very nicely, and I'll demonstrate what happened to me. Firstly, some of these mAbs, I'll list a few ones here that are coming through. I have another video link below on Teprotumumab, so click on that and you'll see what I mean. And they're all new and they're all so fancy, and like everything new, we always want it. But don't forget the two key words: safety and efficacy. So what happened was I received an email from one of the companies producing Teprotumumab, who I spent some time with earlier. And it was a follow-up email, and it was on July 14, as you can see below, and let's go through it. It says, I'm working with Amgen on a national project to better understand how thyroid eye disease, it's not really that, it's Graves' disease, is currently diagnosed, referred and managed across Australia. This person wants to gain insights into clinical pathways and referral practices to help inform future educational initiatives and ensure healthcare professionals have access to relevant updates as the landscape evolves, with the ultimate aim of providing the best possible support for Australians living with thyroid eye disease. Now, whenever you receive something that seems so altruistic from a capitalist enterprise, beware. Firstly, Amgen is a biotech company. But I looked at this email, they wanted me to ring them back, and down at the bottom, I've crossed out the name of the person. It says DKSH on behalf of Amgen. And I'm thinking, hang on, this is somebody else using the Amgen logo below. So it really got to me, and I thought, what's going on? So we went back and asked some questions. And I said, what do you mean by clinical pathways and referral practices? Remember, that's a clinical role, not a biotech company or a marketing company role. As a marketing company, to what educational initiatives do you refer? As a marketing company, what do you see your role in the clinical management of patients? And as a marketing company, what are you proposing to offer as support for patients suffering one type of thyroid immune orbitopathy? Ask them to reply, said reply when you can, and guess what? Nothing. Crickets. So I looked up DKSH, and of course it is an international market expansion service provider. In other words, these people are scoping out the markets to try and find where they can lodge their product. How much the product costs? Let's just be conservative and say well over $100,000. It's a research drug. It doesn't have proven safety, efficacy, or a track record. So what can you do? You want to try something new? We tried that with COVID, didn't go so well. There's another issue. In Australia, it's very tight. Big pharma is not allowed to market to doctors. We used to have business or first class flights and hotels and conferences and dinners and all sorts of razzmatazz. And it's very, very, very tightly controlled now. And what cannot be advertised is prescription-only medications or unapproved therapeutic goods, as all these research drugs are. And there it is, the website is listed below. You can go look for yourself. But these companies are very clever. They're dressing it up in altruistic, serve the public good in order to slot their drugs in and convince the patient, go ask your doctor for this drug. So what do I do? Well, I've been doing this for years. We now have one of the largest series of low-dose orbital radiotherapy. It's close to 200 patients, and we're about to start writing it up. Low-dose orbital radiotherapy will bring the Graves' disease component to a halt. It's like seeing your house on fire and the firemen come along and suddenly put it out. No side effects, just put out the fire. And you can see here these images, the scans. Look at the green and red lines. It's tightly delivered low-dose orbital radiotherapy, which has 0 side effects. And so far, we've been able to stop the progression of every single patient using this. It's painless, it's cheap, and it's available. It's not a research tool, it's available. Radiotherapy was described a long time ago at high dose with no side effects. We use a much lower dose with no side effects. So that's why I say to you that Big Pharma is now after your thyroid, and you'll hear from them one way or another. If it's through your doctor or through another network pushing these new drugs that are going to blow Medicare's budget through the roof when we already have an established treatment. It's very sneaky, it's very naughty, and it shouldn't happen. I hope that all makes sense. I'm Dr. Anthony Maloof of Eyes and Faces in Sydney.